Hello, good morning, good afternoon, and good evening, depending on what time you're watching. If you are new here, I'm Miss Someone Nabrini by name, and I discuss everything health. Today I'll be discussing on how to confirm if you're pregnant. That's confirmation of pregnancy. For those asking, how will I know if I'm pregnant or not? So just stay tuned if you really want to know if you're pregnant or not. Before we talk about ways to confirm pregnancy, we need to know what pregnancy is. So literally, pregnancy is a term used to describe the period when a fetus develops in a woman's uterus, and basically it takes about 9 months in humans. So we've all known what pregnancy is now with this definition. So let's move over to how to confirm if you're pregnant or not. That leads us to how early can pregnancy be confirmed. Pregnancy tests can be positive 10 days from fertilization. It can also be positive 21 days after intercourse if pregnancy occurs from the said sexual intercourse. So literally, for you to be able to know what the 10 days after fertilization is, you should be able to know your menstrual cycle. I'll drop a link below on my video on menstrual cycle. Just watch it and you should be able to calculate yours using that video. So when you're familiar with your menstrual cycle, you should be able to know your said ovulation day. So this leads us to how to confirm pregnancy properly. Pregnancy can be confirmed through signs and symptoms of suggestive pregnancy or laboratory test. I will also drop a link on signs and symptoms of pregnancy. So basically, when you experience a missed period or any other signs of early pregnancy, I'll drop the link below as I said initially, and you've had a recent sexual intercourse, it is time to know if you're pregnant or not. That leads us to the laboratory aspect of pregnancy confirmation. This includes pregnancy tests. This pregnancy test can be done using blood or urine. So either of these pregnancy tests, either the blood or the urine, dictates the presence of what we call human chorionic gonadotropin hormones, which is also known as beta-HCG. This hormone is produced by the placenta within 10 days after fertilization. So if fertilization has occurred after 10 days, you should be able to get a reasonable hormone level of HCG, and once this is present, it should be detected using pregnancy tests. Also, you need to note that some pregnancy tests recommend that you retest yourself 3 to 5 days later. That's if you've done the 10 days test and it's still showing negative, you can redo the test 3 to 5 days later if you get a negative result. This is because a negative result could just mean that your HCG level is not high enough to be detected by the test kits. It is also important to note blood pregnancy test dictates pregnancy 1 week earlier than the urine test. But it is also known that the blood pregnancy test is not a definitive test. Okay, I'll explain this further. In some cases, if your blood pregnancy test is positive, the person may not actually be pregnant. This is due to the presence of what we call heterophilic antibodies, which is also known as phantom beta-HCG phenomenon. So literally, phantom means false. So this is false presence of HCG hormone. I know you'll be wondering what do you mean by false presence of HCG hormone? So what's happened in this case is that the laboratory assay, things we use to run the test, firstly identifies other chemicals in the body as HCG. This happens when some antibodies are identified in the body as HCGs. So you need to do the urine sample test to be definitive. So literally what it means is when your urine pregnancy test is positive, you're definitely pregnant. So that leads us to the next way to confirm pregnancy, which is through ultrasound scan. This is a definitive confirmatory test. This is because it also helps to dictate the site of the pregnancy and also to rule out ectopic pregnancy. So if it's able to dictate the site of the pregnancy, it's going to know where the fertilization occurs, whether in the uterus or outside the uterus, like the fallopian tube. So I know some people will be wondering what ectopic pregnancy is. So this is when the egg implants outside the uterus in parts of the fallopian tube. And also, ultrasound identifies the number of the fetus present in terms of multiple pregnancies. So if you have more than one fetus growing in your womb, the ultrasound will be able to pick it up. It also gives an estimation of the gestational age, like how old is the fetus. So this is why it is called the definitive confirmatory pregnancy test. So with this video now, you should be able to know if you're pregnant or not. So this is the end of this video, and this is me saying thank you once more to everyone watching my video, to my returning subscribers. You have a special place in my heart. Please don't forget to click the subscribe button, the notification bell to get notified when I post a new video. And also don't forget the like button and the share button as well. The comment section is free for your questions, consign, or if you have any topic you want me to discuss, please don't hesitate to drop it down. Thank you very much and see you in my next video. Bye bye.